Hi friends, I am Dr. Niteen Dhepe, Skincity Super Speciality Laser Clinic. Today we will be talking on treatment of keloid. Are the keloids curable? What is the combination laser treatment for keloid and how it works? Keloid is a defect in the wound healing mechanism. Whenever you get a wound, body try to heal that within a week or 2 weeks. 7 to 14 days is a period where most of the wounds are healed. But in some patients, there is a defect in the healing mechanism. Body doesn't know where to stop. So you get a little wound, but body try to heal that excessively and keep on healing it. So after a wound, we get a flat scar. But in case of the keloid patients, that scar keeps on depositing a new collagen, more collagen, and you get a very thick heaped up scar that is called as a keloid. There is a difference between hypertrophic scar and keloid. Hypertrophic scar is just a thickened scar, but keloid is a thickened scar which grows on its own in the periphery. So hypertrophic scar, sometimes the burn scar, accidental scar, you get a thick scar, but it is limited to the original area of injury. But keloid that grows beyond the area of injury. Now what is the treatment of the keloid? Is it curable? Let me first confess, keloid is not curable. What is meant by cure? If you treat and the keloid is gone for lifelong, no other will keloid come, or the same keloid will not come back till your death, that is the definition of a cure, and that is right now not possible with the current scientific research. So what is possible? Yes, we can treat the keloid to a large extent. We can suppress the keloid, stop its growth, we can make it flat, and we can keep it flat for a much longer period. That is called as a keloid stabilization, flattening and stabilization. Flattening means we can make it flat to the skin surface and we can keep it flat for a very long period. So what were the treatments of the keloid in the past? Previously they used to use creams. We classify the creams as a bad creams and the good creams. If you are using steroid creams to suppress the keloid, that's wrong. That's a bad cream. Why? Because steroids will cause the infection in the hair follicle, they can cause the pimples and hence more keloids. Instead you can use a silicone gel creams. They are good. Either silicone gel or silicone gel sheets, they are good. Those are the good creams. Now there are few injections. Most of the doctors, they give Kinocort injections in the keloid. So we classify the injections as the bad injections and the good injections. Steroid injections are the bad injections. Why? Because steroid will induce infection in the hair follicles. It can cause a new pimples. The new infection, new pimple is equal to a new keloid. So the steroid injections will increase having new keloids at the periphery. Of course, they will give a good flattening, say for 1 month, 2 months or 3 months. But again, same keloid grows back and you get new keloids, more number of keloids. So there is a big no for the steroid injections. Instead, you can use some other injections which can dissolve the collagen and which doesn't have the side effect of the steroids. Those are called as a keloid chemotherapy. So there are various different injections, they are under trial and they are better than steroid. Next treatment is surgery. If you put a knife on a keloid, the keloid grows back double. So any surgery will make a keloid worse. So there is a very big no for a surgery in keloid. Very rarely we may need to debulk the keloid, but that is an exception, not the rule. As a rule, no surgery for keloid. Next is the laser treatment. There are, again we classify bad lasers and the good lasers. Any laser which can create a wound or burn, that is a bad laser, because any wound can trigger a new keloid. Any laser which can modify a collagen, which can change the ratio of the collagen, that is a good laser. Recently, the Ultrapulse SCAAR FX, there are some other intense pulse lights which are very useful in the scar modification. So these lasers are used in the burn scars, accident scars, pimple scars. Same lasers, they are tried in the world for keloid treatment. Skincity being the first ultrapulse laser in dermatology in India. So we had the first R&D, first research how to use these lasers in the keloid. Aim in the keloid treatment is not just to destroy the keloid, not to cut it, but change the ratio of a good collagen and the bad collagen. There is a type 1 collagen, type 3 collagen. We want to reverse the ratio because in the keloid there is more of a bad collagen. We want to dissolve the bad collagen. At the same time, we want to enhance production of good collagen. So to achieve this, Skincity has a combination protocol. It's called as a Keloid laser protocol, where the various lasers and keloid chemotherapy, various lasers, creams and the pressure, all they are used in a various proportion, because no single treatment will work in keloid. It requires a combination, and in this combination, which treatment has to give how much weightage is the real expertise, is the real experience. Skincity has the experience of treating keloids with the various modalities last 20 years, and we have developed since 2008 a combination of laser and other treatments which gives reasonable flattening. So what to expect in the keloid treatment? Firstly, it stops the itching. So the itching will stop, say, in one treatment. It stops the pain. You get the pricking pain, pin pricks you feel. In 2 or 3 treatments, that pin prick is stopped. Third, it reduces the chances of infection. Many patients get a pus and infection and the pain, and you have to drain the pus, take antibiotics very often, every month, every 15 days, throughout the year. That's very painful. That infection is reduced. You get infrequent infections now, and you stop getting the infections eventually. Then it becomes flat. Still, you need to continue the treatment. This keloid treatment has to be continued as per the assessment and grading of the keloid. You may need around 1 year, 2 year or 3 year. Usually 12 to 40 months we need the treatment on a keloid, and that gives an excellent stability rate. So what is the stability, how it is maintained, that we can see in the next video. So friends, keloid is an incurable disease. There were no treatments in the past, but now the latest options of combining safe treatments, including the lasers, have changed the scenario. They are very much effective in controlling the symptoms of the keloid, making it stable, and this stabilization can stay much longer. Thank you very much.